Okay, because welcome everyone. And this is that what the practitioners can do. And I see so many names here that I recognize. And great seeing you again. The newest one I think is Petra Vanilla Buckman. And we can get more information later. And so our goal really is, we said Surili was going to present a framework, an idea of something that demonstrates this intersection. Then we would take it from there in a discussion using some of the ideas, what we heard from Dr. Jones, and see in the end a good way for practitioners to make those changes. So Surili?
Yeah, Dr. Holder, would you like to lead us in a discussion of what we reflected on from Dr. Jones?
Yeah, right. We were starting earlier. Was just looking at what Dr. Jones talked about, our barriers to health equity. Just what were your thoughts and what do you think has changed or what you would do differently after hearing this? What you're reflecting on what she said, because she said an incredible amount of so much information, one of the best lectures I've had in years on racism.
I can kick us off since I had the advantage of knowing what you were going to ask everyone. So I listened to her remarks, again, in awe. In recent events, 2020, and also even more recently, what's happening with the Asian American community, I think for me personally, taking her 4 mantras at the end, I forget what she called them, but it was be courageous, be curious, be collective, and build community. And I think all of those resonate with me, and certainly the build community part, especially as I'm talking to my Asian American relatives and what, structural racism meant to them when they first came to the country, and also what it means for future generations. I have a group of cousins with little kids. All of us have little kids, and we constantly talk about how do we normalize things that were so not normal for us growing up for our kids, so that we are raising them to be conscious, but also be not, don't fall into the same ways of thinking that we inherited or grew up around because of our environment, because there is a personal choice in that. And how do we build a community of the next generation that is free from some of these challenges?
Anyone else? No, I agree. It is very difficult to have these conversations. Even in my climate talk, I don't say the word racism straight out. I always have a slide on 1619, and I talk about oppressed people and the history. So my climate talks always keep the historical context in. But sometimes I don't just call it out to sort of ease people so that they listen to the rest of it. So I think her charge about being courageous, I said, maybe I should be more courageous and call it out, because somebody in the chat, I think Shakobi said, you can't talk about climate change without talking about environmental racism. And I don't know what we think about that.
Yeah, this is Mark. I talk a lot more about racism. I've become, I think that people are more ready to hear, but I think that putting it as a systemic, I think people see systemic racism more now that everybody has a camera phone and that we can see how at least police brutality. But I think that people are open to seeing systemic racism, and that they are learning. I think that people are learning more about how policies have got us here, and how policies can change to make things better for all. Even though we're having some backlash under the, with the past administration, I was, thrilled with the number of people and the types of people from every type of people in the U.S. that were marching against systemic racism after the George Floyd murder. So I think it's an opportunity for us, in climate change. We're going to have to change in order to address climate. We're going to have to change all types of systems. We're going to have to, address housing to make it more climate resilient. We're going to address the electrical systems in Texas, which also affect the water systems, which also affect all of the other systems. And we're going to need to change all of those to make them more resilient, but we can also, change them to make them less racist and more equitable. We need to talk about the investment that's needed in order to address the disinvestment that's been made over the last 30 or 50 years or 100 years. I was talking to some young people a few weeks ago and showed them a map of environmental justice communities. And they said, well, that map is from, 2000. That's 11 years ago. So don't you have something that, hasn't it changed since then? And I laughed. I said, no, it's not going to change unless there's a change in our policies, unless there's a significant investment, and that hasn't occurred in the last few decades.
Anyone else? Cheryl, I was just curious. You're one of our, I'm being courageous here. You're one of our white males here. And I'm wondering, in your presentations, when you talk about climate, how do you address race?
I talk about all environmental problems as being environmental justice problems, that there's no environmental issue that's not an environmental justice issue, because discrimination has been so pervasive in our systems, and that we can't manage climate change going forward without simultaneously managing the racial inequalities that are built into the system. So those are some of the things that I talk about. One of the things I'd be interested in hearing others, one of the reflections that I had was a reaction to her pointing out the issue of meritocracy in our country, because in a certain sense, I believe that meritocracy exists and works, that each of us in our squares here has gotten to our square because we have worked hard and gotten ourselves to where we are. That doesn't, I think, completely void the complementary notion that there are some people who work very hard and don't get into squares like these. But I think each of us got here by hard work. I don't think we got here by luck, or I don't think we got here because there was preferential entrance into college for African Americans or people who live in certain zip codes in the state or whatever. So I wrestle with that notion and I'm actively trying to figure out how to come to terms with the various aspects of meritocracy that I understand and see.
Yeah, what I see with meritocracy, I see there is a advantage, there is something of everybody working hard, but I see it with MCATs in that when you get to a certain level, what separates out working hard and doing well? And that's when I see meritocracy used to hurt folks who are just as capable of being great doctors at an MCAT score at 500 as an MCAT score of 515. Yet this idea of meritocracy said we should reward the 515 because we assign greater value, which is not based on any data saying that 515 is worth more than the 500. And when we do that across the board, we bring in a lot of structural issues that shows that the only reason that student got a 515 was probably because their parents could afford to give them more tutoring, pay for their MCAT prep, pay for their summer camp, and pay for all the other resources. It didn't mean that that person was any better intellectually than the other person who didn't have all those advantages. So I see meritocracy used to the extreme where you then assign value incorrectly. And I use it since it's Doctor's Day in physicians, and I see it all the time.
And if I may, the scores aren't everything. There's a lot more. Fill medical school with 4.0 students. That doesn't mean that they'll make the best doctors. There's a lot more to it than that. And then, I always think, what can people do to deserve making it $2 million a year? Much harder? Are they that much smarter than anybody else? Versus somebody who makes 100,000 versus somebody who makes 50,000 versus somebody who makes 30,000. How do they deserve $2 million a year? A hospital CEO or whatever. I just know a lot of people who work very hard that and are just as smart that aren't as successful.
Goes back to her conversation around the soil and how some soil is nurturing and some environments are cultivating, and that differentiates some from others in their ability and aptitude to meet those predetermined benchmarks that have been created in a vacuum, if you will, whether it's the MCAT score or the ability to rise up in ranks in an organization. And I wonder often that when we're talking about climate and we're talking about communities of low wealth, and I wouldn't say wealth versus income, that it's so easy to pair them with also communities of color. And they're not the same, but they are in a lot of instances. And so when we're talking about racism, when we're talking about environmental justice and health, climate change, it's often hard to disassociate the two, yet they're very two distinct, and there's two different conditions oftentimes that the soil, if you will, for those flowers.
Yeah, I always talk about how how racism makes sure brings a lot of different disadvantages, and how it sort of combines a lot of the types of disadvantage, and that's why people of color of all incomes are disproportionately exposed to environmental hazards. So I think that it's really, really critical that we recognize that, and that we make sure that people of color are at the table. It matters, and in my experience, we know that, for example, that physicians of color make about half as much as white physicians. Not that physicians of color are in poverty, but physicians of color are more likely to be near poverty. Be near people who are in poverty, either relatives or friends or in communities. We know that African American physicians are more likely to serve low-income communities of all races, and are more likely to serve people of color, and they're more likely to get better results in the treatment, from their patients, and the health outcomes of the patients. So racism is real. It is strong, but I every time I listen to Kamara, I learn something new. And she does a fantastic job of bringing a different perspective, and her allegories work well. I'm not sure that I would be the best person to tell those stories, because she does such a great job in I guess she's an actress also, as well as a physician.
What I think the challenge is how I've been trying is how it benefits all of us. And I find, for me, that's one of the newer elements of the racism discussion. Because even coming up, knowing about racism and experiencing it, and then realizing that it hurts other people. It hurts the people inflicting as much harm. I think I forget what $1 trillion budget tab they put against it. And I've been using it in the climate justice arena, in that I address it because the sacrifice communities, or what we call the fence line communities, when you think about it, if we had cared about those communities, we would have made this disinvestment in fossil fuel way longer. It wouldn't have been them and us, because it would have been all of us would have benefited from not having the pollution. So these are some challenges I've been seeing, how to bring that intersection of race, health, and climate justice, where everyone listening see why it's for all of us benefit to dismantle some of the systems that we're seeing. I don't know how anybody else is bringing that in as we try and reshape these systems and institutions.
Yeah, I think it's very difficult. One of the reasons that Kamara's talk is so terrific is that she really does break down all these components that can help people who don't have a direct perception of what's going on. about what is going on. I mean, if you are kind of, been looking at society and thinking about all these things, and you're curious about it, maybe you have been perceiving much of what she talks about, but a lot of people are not. It's taken me a very long time to realize that, many people are really just caught up in their own sort of narrow world, their day-to-day world of their own lives and circles and homes and families, and just don't think outside of their direct, day-to-day experience very much. And I think it's very difficult, to help them understand these experiences. And, so that's one of the reasons that Camara's talk is so terrific, that it really does allow for, understanding of components of the whole system, the whole way that systemic racism works, that people may not otherwise really be able to perceive very well. And I guess I've always felt that it's so important for people to have some direct experience of people who are different than they are early in life. That we should be introducing children, in early ages and during their early schooling, if possible, to other children who look different than they do and who have different backgrounds and different experiences. Because then, just like we talk about creating that like grandmother cell in the mind of the little baby, it's like you just created a grandmother cell. That child now recognizes you in some way that they didn't before, if you get to meet them when they're a child. And so then they sort of accept that person in some organic level, some visceral level. And I personally think that we need to do a great deal more of that, so that there are those little cells, in the brain before other people who look different. And it doesn't have to be just, when the children are infants. I think throughout schooling, there's still an opportunity for children to meet others and to, get to know them, or, recognize them in a way that makes them not other. It makes them, sort of part of the common experience and their common humanity. And so I guess I personally would like to see a great deal more of that. And, is medical school or nursing school or, health professions training too late? No, it's probably not too late. But we should be doing a lot more sort of active, efforts to bring people into contact with each other when they are in common training, so that they do rub up against each other more and just feel more comfortable and, and have more experiences in which they are together with people who are not from their very same background. So I don't know. I mean, I know that some colleges and universities are trying to do things like that. I don't think medical education is trying to do things like that right now. Maybe they are, since, this greater effort to address racism. I've not heard about it, so I don't really know if they are. But
again, racism is not discussed other than you get a one session, but there are efforts to integrate the students in the community in pretty much most medical schools. And our school goes above and beyond, but most schools do. Now, is the lesson learned? There's the whole thing on social accountability and cultural humility that's being encouraged throughout. But when you come into the greater world, what the students tell me is then they get the microaggression and they see where the rest of the community is not as advanced as our medical schools are. So that is where we see it. Because I even think of our climate organizations, how much are our climate organization matching with our environmental justice organizations, which have been around for a while. I don't know how we're bringing those two together. Jerome, you have to say?
Yeah, it says Jerome, but I'm really Jerry.
Okay, Jerry, yeah.
I don't know how to change it in this particular set of boxes, because for me it says you.
Yeah.
But anyway, can you please unpack what you just said a little bit in terms of the medical students, and they get a certain amount of instruction, but then when is it that they start to experience the microaggressions, and then have this discordance between expectations and reality? I mean, it would seem to me that would be nothing new in their world. But I'm not obviously.
And labeling it is much more, because we're giving them the vocabulary and they're getting the class. So usually first years, most medical schools will talk about all the different social determinants of health, and racism and all the isms are always discussed. And then they'll go into the communities and the professors will teach it, but then you'll meet other professors in your environment that may not demonstrate it. Like you'll hear the students say, oh yeah, he's one of these all Black, all lives matter doctors. And they've heard the difference, because we'll have a big white coat organization, and then they'll go out and meet the doctors who talk about all lives matter. Or they'll do third year when they start rotating through all the different hospitals. That's when they will see that we're teaching one thing, but they're not really experiencing it. So I think when I was coming through medical school, we would witness the doctors being verbally abusive, or saying these comments about patients, house of God back in my day. And it was not, we knew it was happening, but we didn't call it out. Now medical schools are encouraged to identify it, verbalize it, and call it out. So when they see it, they see the discrepancy in what we're teaching and what they experience, and they're able to call it out. But they're not ready to speak up and fight against it. They're just willing to say, we talk a good game, but in reality, everybody's continuing the same.
Thank you.
But we're doing better in at least acknowledging that these things are happening. Like our Asian students just had a session, and one of the first questions they asked, and Surili is here, so you probably understand this. What is your Starbucks name? Do you have a Starbucks name, Surili? All the Asian kids had a Starbucks
I
name.
used to, and now I will sit there and help them spell my name. Yes. Yes, I do understand that question, unfortunately.
Yeah.
So can you explain it to the rest?
These are the things. Oh, go ahead,
Yeah,
Surili.
when you go to Starbucks, if your name isn't Jenny or John, then they butcher your name. And so I take the liberty to, I used to give them a short name. Like I have a friend growing up called me Lee my entire life. And so I just give that name instead of Surili, because Surili, over the cacophony of whatever steaming or whatever is happening and the lines and the chatter, is too hard. And now I just stop and say, I'll help you write my name, because my name matters. My name means something.
Great. Thank you for explaining.
Yeah, that's good. Right, because Mark, I know you probably never experienced that.
No.
Now, I experienced it in the Spanish world, so I'm Clara or Carla, either one, because it's easy to pronounce. So I have no problem with I avoid the whole situation. My son is like Surili. He insists that they spell it properly and call him his name. But it's just something that just minor, but you would think would be minor, but every child in that group that we had our Asian discussion about discrimination and anti-Asian were a little bit annoyed after a while that people wouldn't even take a little extra effort to say, I see you, I hear you, let me try.
And I'll say, growing up, my parents' names aren't very easy. They're a little bit more easier than mine. But I would see how non-Asians would treat my parents because they had an accent or because they spoke certain words. In India, the English language has a lot of influence from the British culture, obviously. So a lot of things are different in that regard when they learned the English medium. And so I could see as a child that as early as third grade, I have memories of stepping in to translate for my parents, who were both very English proficient. And I think that has an impact on I'm first generation, but on first, second, and so on and so forth, where if you're constantly translating for your adult that cares for you in so many other ways, that is an undue burden on children. And it also immediately others you, because no other child in your class is translating for your adult. And that speaks volumes. So that's the whole, like, I see you, I hear you. And living through that is its own type of pain.
Yeah, and that comes again from racism, which we never identified and called it what it was. Again, assigning value to the name, assigning value to the accent, and your willingness to adjust to it. So that's when I do like the definition of racism as being systemic. And then how do you assign value? And you have to address both of them to be able to make a change. And I think in the climate world, that's so important, that we can't separate one from the other, or else we'll end up back with sacrificial communities, which is what we're hoping with equity that we don't have. And it won't even be communities, it'll be sacrificial countries if we look at it, or even if we take it even bigger than just health, but whose health? The animals, the insects, the plants. Are we going to sacrifice some of our species, depending on how we assign value? So I thought the presentation really made me think and see how we're going to address and reshape these systems and institutions.
This is Jessica.
10 minutes.
Can you all hear me okay?
Yeah, Jessica.
Well,
Yeah.
I identify I am white, but my sister also has a Starbucks name because her name is Nada. So she also has to have a different Starbucks name. I just wanted to think a little bit about with this group who, we're all active in health professionals working on climate and health. And, you asked early on, how do you bring racism into these talks and this work? We recently, we have an Emerging Physician Leader Award, and one of the applicants, and this year we had the medical students or residents submit a project they wanted to do. And one of the applicants actually came from South Florida, and her application was about her experience going into the community. And that was something that Dr. Jones really talked about. That's one of the ways we can foster this is to go to the other side of town. And she described, and she did a beautiful job in this application because she told the story of going to someone's home to take care of her, I think it was a cardiovascular condition, and being so miserably hot in the house, and she could not wait to get back to the air conditioner in her car and the air conditioner in her apartment. And then it kind of hit her like, wow, I can get away from this, and this patient can't. And what is the impact on this patient's cardiovascular status living without air conditioning in South Florida? And the project she submitted was actually about screens and replacing screens because of vector-borne illness. And, I was really moved by it. And I wonder in our work, and this really inspired me, as we have small grants for projects or awards that recognize people, how do we prioritize these issues? How, when we run, we support the clinician climate action groups in doing an education day-long symposium, do we make sure someone is talking about racism and talking about that you can't solve climate change without addressing racism? How do we commit to that as the group of CHE grantees to say, this will be a priority? I mean, Dr. Holder's speaking next week, actually, at our Southeast Florida Climate Resilience Summit. Let's let's talk about it, right? Like, let's not let an opportunity go by, and then, you know, just opening up to the group, like, how do we do that together?
Anyone? Thank you, Jessica. That was incredible. I think I know the students, either Miranda or Samantha, because we work on the project together. But what do you guys think? I mean, how do we?
Well, I think, you know, Mark often says, Mark, I'm quoting you, that this, you know, last year, with the racial reckoning since the murder of George Floyd, has really pushed everybody to think about how it's possible to address racism. And I know, you know, we've spent time on it in the consortium, and all of the clinician for climate action groups that we're involved with, you know, have been encouraged either by themselves, you know, by the members, or by some of us who are working with them to actively come up with an agenda. And so, you know, the Wisconsin group stepped right up, and, you know, when they established their committees, you know, there was a racism committee or anti-racism committee, and the folks in you know, Georgia, I don't know. I mean, Jerry knows a lot more about what's going on with the folks in Georgia. I know, you know, Jerry has been involved with the Virginia group, and I've attended a lot of those meetings. And I think we both sort of started to push, what can we do as a group? And Jerry, you know, suggested some ideas, reaching out to the NAACP in Virginia and making contact with one of the environmental justice communities in Virginia. And it turned out they had a big project which really needed to get attention. And it's fascinating what's going on there in Charles, you know, River County, or Charles City County. And so things, you know, I don't know, Mark and Jerry probably want to comment, because, you know, there's been stuff going on in all of the CCAs that we're associated with one way or the other. And so that it definitely, this year has definitely increased everybody's, you know, recognition, ambition, you know, concern, willingness, desire to do something.
Yeah, as a person who started and ran an environmental justice organization, I recognize that it's hard to get attention, and we as healthcare providers have access to megaphones, and I think that, you know, Cheryl has done a great job at working with the environmental justice groups in Miami and making sure and trying to help them, you know, once they decide on their climate justice priorities of heat and you know, that we can talk about how we see that affecting health, and we can help to make those, you know, priorities for addressing climate change in those communities by, you know, taking the lead from grassroots organization, by granting to grassroots organizations, increasing the diversity. You know, we started our fellowship training. The consortium started a fellowship training in partnership with the National Medical Association. You know, there needs to be, I think, engagement with the you know, National Hispanic Medical Association, and the nurses, the Black nurses, the and other groups, and, you know, I think we need to, as organizations, sort of partner with other groups that are most impacted, and learn from each other. Is what I'm.
Thank you, Mark. It's 4:03. We have a break. We can continue on for another 5 minutes or so. So I just wanted to let folks know that of the time. But I've heard what Mark was saying about all the different that the consortium's doing, and I do applaud the effort of trying to bring the environmental justice groups in, because they often have more of the community-based folks and bringing in the health arena with the climate folks. Not everybody is community, but the environmental justice had more of the people of color than the climate world, which has more of the more educated, richer white folks involved. And I think it's a very good partnership that I see across the country that's happening. But anything?
Yeah, and in that regard, Kresge also really set the example for us by bringing us together last year in early February with the communities that were doing environmental justice projects. And so we got to learn about the projects that they were doing. And this was really quite conscious on Kresge's part to bring the health professions and public health groups together with the environmental justice groups that were doing projects that they were, funding. They put out planning grants. And so these were like 10 communities got the planning grants. And so they very self-consciously brought us together with those groups. And I think they set an example for us that was very helpful in showing us, sort of that, allowing us to get a better sense of some of the kinds of projects that were going on. And so climate gentrification is a great example for me, because I don't think I really would have understood what climate gentrification was had I not, learned about what was going on in Miami or learned about what was going on in Austin, because I met the people, from Austin. I had learned from Cheryl about what was going on in Miami, with the wealthier people moving to the higher ground, which previously had been the cheaper housing, because of sea level rise, and then learned about what was going on in Austin, where those areas that were flooding, people were kind of moving out of the areas that were flooding or moving around the community, so that the more expensive housing was becoming those places, maybe in the same general community, but that wasn't flooding, and just sort of how that happens. And, landlords can change, either do condominium conversions or whatever. And, people can find themselves literally, having to move. Anyway, so learning the experience of some of those communities, from the organizations that represent them, I think is key. People really need to be in touch with them so they understand better how it works, and then can help think about solutions.
Yeah, I think that's where I would race, where you do have to pay attention, because as the affordable housing and the housing issue becomes so much more problematic down where I am, it depends, will they let Black folks now rent back in these areas? And I'm already seeing the same patients that were living in Liberty City and Little Haiti can't get apartments. They can't find anything. They're not renting to them, these new landlords. And I know the historical record is that race plays a role. So I do see where we do have to be able to speak it, name it, and confront the changes if we're going to really have an equitable solution to this climate crisis that we're in. And these institutions, it does bring the challenge, I guess, like she says, we have to be courageous in some way. Like Jerry and I, we do talk about it, that yes, this climate is affecting all of us, some more than others and more vulnerable, and we bring the historical impact, but maybe to just call it out and say, how are we going to work towards our basic inner biases that are structurally based? That's racism.
Yeah, and workshops obviously play a huge role. I went to the workshop that Surili organized at the APHA meeting, 2 years ago, focused on energy poverty, and that was another area that I don't think I really knew much about until, like the whole sort of 2 or 3 hours focused on that problem. And So, I'm sure everybody who was there learned a great deal about what that meant and how it worked, and, could then take that forward.
That's what we were supposed to be talking about.
Yeah.
Energy and security, and seeing if there was a way for this set of CHE grantees to possibly talk about, well, first, defining the problem, right? The health problem and the health solution from it, but also getting on the same page for the nomenclature. I mean, as health sector, there's so many ways to be interconnected with other issues like housing and energy and food and air quality. All those things come together. The common denominator is climate change, but all those things play a role. And one thing that, Mona, from that roundtable we learned was that not everyone was on the same page in terms of the language, because energy is like over there. We don't have to worry about it, but we do, because it impacts us in so many ways, more than other than we can talk about. It impacts us based on race, because of, previous lending practices that are sometimes still kind of in effect, but not legally in effect. We are still seeing them play out in other ways in terms of divestments from communities as a whole, and that, that disparity in, the wealth of a community and what that means for the outside of a community, the outdoor space, and then the climate adaptation portion. So there's so many different ways that energy touches health that it's been a journey. And I wonder, because we look at it through the social determinants of health, the structural determinants of health, that we have a kind of a unique vantage point as health professionals to take on the issue.
I know, so often hospitals, hospitals are assessing the communities that use the hospital, and then trying to understand, what kind of services they have to have in place and so forth. And some of the hospitals that I've worked at had really well-developed community education arms, which tried to understand the various communities and reached out and did surveys and so on and so forth. So I don't know if that, if that is a way. In one hospital that I was at in Philadelphia, that definitely provided an entree for those who were concerned about the social determinants, to draw the attention of the hospital to those communities and to the problems in those communities. But then it's still a step further to think about, what kind of impact the hospital can have on that. And I know, a lot of people who run the hospital just don't think they have any impact or can have any impact. They're just there delivering their services. So that's a very big, a big hurdle. And I don't know whether Healthcare Without Harm is already, figuring out some ways to try to get over that hurdle.
We are working on it. And under the Affordable Care Act, the health systems have to do the community health needs assessment every 3 years, and then they're supposed to address those top identified needs with community benefit money. We've been working over the last few years to try to get even questions about environment and climate and that experience into these community health needs assessment, and we have a few good examples from across the country. But even when you put in climate impacts, they often, are going to be lower than the other social determinants of health, like housing, for instance. So we see a lot of health systems then investing in housing, which is wonderful, but we've got to bring the climate lens, the race lens, the environmental justice lens to the work they're doing on housing. So we're trying to break down the silos within the hospital themselves. Sometimes sustainability people don't know the community benefit people or the community health people. So how do you help them see this nexus where the social determinants of health is, climate change is part of that, right? It's the threat multiplier for all of them. Environmental racism sits at the nexus of the social determinants of health. So that's the work we've been moving towards, and there's definitely interest, and I think COVID and the connection to air pollution has really awakened many health system leaders, and they're starting to make these bigger connections. So I think, between some of those aha moments coming out of COVID, the racial justice uprisings we've seen, Dr. Jones showed that map of all the places that have said that racism is a public health crisis. We're seeing the same thing with climate, right? We're seeing more people say climate is a public health crisis. We're seeing health systems say racism is a public health crisis. I think we're moving in the right direction and we have momentum, but health systems need to figure out how. And that's where we're trying to fill in those blanks for them, because they can talk the talk, but how do they really walk the walk? How do they really invest in their communities in a way that builds community climate resilience and understand where the communities have need? We have a great project we did called Anchors in Resilient Communities. It's probably being talked about. We did it with the Emerald Cities Collaborative. It's probably being talked about in another breakout, which really shows how health systems can do that work and really use their position as an anchor institution and use their purchasing power. But, that is a 4-year project, and we can't do one project at a time over the course of 4 years. So, when I sit and look at what's happening, I want to innovate, but we need to scale and transform. And, how do we accelerate the pace of that work?
I think Chris Cable in the chat the pathology and soreness of hospital CNAs are highly variable. So the community benefit so the degree of which community benefit dollars follow identified priorities are very variable.
Right.
I know in our communities, very similar issues.
Yeah. I live in Hartford, and it's 80% Black and Latino, very low income, and our environmental justice organization across the street from the largest hospital in the state. Yet when they did their community analysis, we weren't invited in. One of our major problems is asthma, and they never considered asthma in their analysis of what's happening, of health issues in the city. And we were trying to, and I was trying, as a physician, I was trying to figure out how to impact their, community. I knew that there was a community health assessment. And so I found that I started tracking down people who would be doing it. We don't, we've already done it. We're in between surveys now. Call me when the next one's ready. But and I haven't heard from them anyway. So, is there a way? I mean, is there a standardized way of community assessments?
Yeah, this is where some leadership from HHS can make a huge difference, I think. So, I mean, if CMS, took the lead in, holding certain kinds of convenings and, required meetings and so forth, and the Biden administration, because they are putting an emphasis priority on racism, I would think they would be in a good position to get, CMS and HHS to take some, proactive, efforts to focus in this way, so that hospitals felt that they had to actually look at racism and the extent to which racism was impacting the communities that they provide care for. Then they would have to start, asking some of those questions and finding the groups to talk to. But so I guess that also means having the folks within HHS or, I don't know, maybe some of the people in the Biden administration, can actually move in this direction if we can make those suggestions to them.
I think using the conditions of participation for Medicaid and Medicare is a huge lever we absolutely need to pull. It's something in our meetings to date, with policymakers and administrative officials we've talked about. I think it's a great way to go. And I think that integration, when we're talking about climate, to always be talking about race as well. And for the Biden administration, you know, these are shared solutions. They have 4 priorities: COVID, climate, race, and build back better, right? Build
Economy.
just
Yeah.
green economy. Health's at the center of all of that. Those are the social determinants of health, you know, and it's time. I mean, time is ripe for that healthcare voice and healthcare leadership. So I think we all have a moment.
I think that you're right, Jessica. I think my concern, and you know, I would hope among the 6 of us plus whoever else is listening in but not showing their face, you know, do the people in the administration who are working on infrastructure in fact realize that there is an overlap with health? We may realize and see that the Venn diagram of, you know, COVID, race, build back better, et cetera, and climate all overlap. But do the people in the administration who are working on the various bits and pieces really see the big picture? I don't think so, at the individual level. And how do we help them see that big picture, the overlap of the different parts of the Venn diagram?
I have to step in a little bit because it is 4:20 and we're supposed to have a little time with EJ before we start back at 4:30. So I don't know if we can answer that question. If you want to go on for the last 10 minutes, but I want to give everyone the opportunity to know that there was the DJ, Asia, and then at 4:30 is the closing plenary. And so
I can speak to it, but I'm happy for us to take a break and Jerry to follow up with you. But I would love to continue that conversation.
yes, well, thank you,
Yeah,
everyone. It was
offline.
a great discussion. We'll have to continue. Luckily, we see each other in all the different arenas over the next year. And looking at our title, our topic was "The Time Is Now: Reshaping Systems and Institutions that Intersect with Race, Health, and Climate Justice." I think we've answered many of the questions and challenging based on what Kamara says about being courageous and using race in understanding that toppling racism improves the health for all of us. It was $16 trillion is what the Citibank Vice Chair Raymond McGuire said when they did an analysis of racism. $16 trillion is what it cost our society. So if we understand clearly the health impacts, the dollars impact these hospitals and our systems, it will understand that we're helping all of us by addressing racism and climate and health. So please continue the conversations and go find our DJ Asia, and we'll see you back at 4:30 at the plenary. Thank you, everyone,
Thank
for this
you.
great.
Thank you, Cheryl. Really appreciate it.